I wanted you to see that I had a normal life before I became a jerk. I'm here today on April 12th, 2017 to gab about gabapentin, the drug that did this to me. It's also called Neurontin. I want you to know how doctors might handle your case if you develop a sudden or a gradual onset of a movement disorder from a prescription drug. On January 3rd, 2008, I had a neurology examination in Longview, Washington. He described me this way: motor examination, strength and tone were grossly normal in all major muscle groups in the upper and lower extremities. There was no evidence of focal wasting or vesiculations. There were no abnormal movements such as tremor, dyskinesia, myoclonus, or asterixis. Her appearance was appropriate to chronicle age. I was 59 years old at that time. I did have a slight hand tremor, but he said that was normal for my age. 3 months later, on March 26, 2008, I asked my doctor if there was anything he could give me for nerve pain. I was given a prescription for Neurontin 300 milligrams, take one every 8 hours. I didn't really like the increase of hand tremors, but the following morning I decided to try one more. The doctor was called about an hour after the uncontrollable movements began. He said that side effects always wear off, but in my case, they didn't. He saw me 15 days later, but he took one look at me and he didn't ask me any questions. The neurologist and the specialist that he sent me to didn't inform me about my brain MRI results that were taken on October 9th, 2008. The specialist claimed the results hadn't been received yet, but he said, "I'm sure you didn't have a stroke." In 2012, I asked my doctor if my condition could be tardive dyskinesia. He answered, "No, you don't have that, and I will send you back to your neurologist." He sent information to other doctors, and this is what he said. While talking to the patient, she developed an increasing tic and tremor involving her neck and left upper extremity. However, it was noted on leaving the office and being in the waiting room, she did not manifest the tic in her neck or the tremor in her upper extremity. There was no mention of being referred to the Vancouver neurologist, who was the first one to see my movement disorder. The neurologist said she has these abnormal movements which are unrelenting: dystonic posture of the right hand, jerking movements to the head, neck, and arms, restlessness in legs, decrease in balance. The right shoulder tends to rise like a dyskinesia and stays tonically elevated, choreiform movements to the upper extremities which come and go. The movements appear ballistic at times. He wanted me to be seen by several movement disorder specialists at a nearby medical university hospital. After that appointment, I asked for my medical records, which included my first brain MRI results. Even though I had the brain MRI results to read, I certainly didn't understand what it was about. While searching online late one night, I received an invitation to ask a doctor a question on healthcare magic. It was only $20. I knew he couldn't diagnose me, but I thought he might give me some clues, so I'm going to read it. He's a pediatrician from Hyderabad, India. I'm 64 years old. On March 27, 2008, I had an adverse reaction to Neurontin 300 milligrams capsule given for nerve pain. The reaction was on the second day, flailing limbs, laughing and crying spells. My eyes saw bright light for several minutes like TV snow. Every nerve in my body was affected, uncontrollable movements in every part. My nerves feel like they are vibrating rapidly through me. The MRI showed my hypothalamus gland has a 5 mm lesion or hamartoma immediately inferior to the optic chiasm and right optic tract. The pharmacist said it was my doctor's fault for not giving me the lowest dose of 100 milligrams. I do not think my doctor was wrong, since the physician's desk reference doesn't even mention the 100 milligram pill, but I did find it online. I suspect that my doctor was not even informed that he could have started me on a lower dose that was available. I feel like other people could have the same reaction, especially the elderly who might receive it for shingles pain. I did report it to MedWatch in 2012. Before that, I was so depressed. Only one good thing happened to me. I developed the ability to write poetry. I often think of one and write it down. An hour later, I asked him a second question, but he couldn't answer this one. Why are the people who should be believing these movement disorders are drug-related trying to say they are psychogenic? The National Institute of Neurological Disorders and Stroke are reporting that people on YouTube, 66%, have a psychological condition or mental state rather than a disease with a physical cause. They could not touch their muscles or take case histories. They looked at their faces. I found the terms physiognomy, which is an assessment of a person's character or personality from his outer appearance, especially the face. What would they say about my character if they looked at my tics and tremors and the loss of my smile? Doctor's reply: thank you for your query. I can understand your concerns and worries about the medication and neurological, emotional, and mood-related symptoms. As you have developed reactions on the second day of starting Neurontin, like emotional lability, flailing limbs, and abnormal movements, it could be related to drug-induced adverse reaction. But at the same time, you were diagnosed to have a hypothalamic hamartoma, which may cause emotional lability like uncontrolled and unintentional laughing and crying, called gelastic seizures, and abnormal movements. Another reason for supporting this is dystonia of only the right hand. Structural lesions of the brain will present with one-sided symptoms, so hamartoma of the hypothalamus may be considered for your symptoms. Another possibility. Drug-induced adverse events usually will subside once that drug has been stopped, whereas the symptoms related to hamartoma will persist. The minimum dose of Neurontin is 300 milligrams, and even lower dose, like 100 milligrams, is indicated in patients with kidney function impairment with low creatinine clearance. And I congratulate your creative work of writing poetry. One thing I really appreciated about Dr. Ramana was that he did give me that clue of gelastic seizures for laughing and crying spells, and I looked that up online, and it took me directly to tuber cinereum hamartoma, which I had forgotten to mention the exact location of the 5 millimeter lesion, but he recognized it and said that that's what it was. I have been looking for the right diagnosis, but I actually predicted my own diagnosis when I asked him or told him about doctors looking at online videos or calling them psychogenic, and sure enough, that's what a movement disorder specialist called me. And I used the other word. I said, "Are you basing your diagnosis on physiognomy?" She looked at me like, "What?" And then she said, "No, I'm not." I said, "Well, I think you are." And I've just been wasting my time coming here. I went 2 times, 6 months apart. And evidently she didn't know about an infarction affecting the subthalamic nucleus at or near its connections, which I found in a medical book that I bought. I don't think any patient should ever have to resort to buying a medical book to find a diagnosis and to rely on online doctors to give them information. And if I were you, I would look up online any drug that you take, and always be sure to put the drug's name and then say side effects, and it'll take you to sites like drugs.com that will give you the worst side effects that they want healthcare professionals to know about, but evidently they don't want to know about these bad side effects. And there's another place that you can find people that are trying to withdraw from Gabapentin, Neurontin, on Facebook, and you have to ask for Gabapentin, Neurontin withdrawal support group. These people are having terrible side effects, even on withdrawal, and the doctors are not believing that it is Gabapentin related. That's all I have to say today. Thank you.